Tamsulosin Hcl is a medication used by men to treat the symptoms of an enlarged prostate, also known as benign prostatic hyperplasia, BPH. It does not shrink the prostate, but it works by relaxing the muscles in the prostate and the bladder. This helps to relieve symptoms such as difficulty in beginning the flow of urine, weak stream, and the need to urinate often or urgently, including during the middle of the night. Tamsulosin belongs to a class of drugs known as alpha blockers. It is important not to use this medication to treat high blood pressure. The usual recommended daily dosage of Tamsulosin Hcl is 0.4 mg taken once a day. It is best to take it 30 minutes after the same meal each day, as this can help to reduce the risk of side effects. It is important to follow the instructions provided by your doctor and pharmacist, and not to take more or less of it or take it more often than prescribed. Remember to take it at the same time each day to help you remember. When taking Tamsulosin Hcl, it's important to follow the directions provided by your doctor. Typically, you'll take this medication by mouth once daily, 30 minutes after the same meal each day. It's important to swallow the medication whole, do not crush, chew, or open the capsules. The dosage of Tamsulosin Hcl will be based on your medical condition and how you respond to the treatment. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same time each day to help you remember. Be aware that Tamsulosin Hcl may cause a sudden drop in your blood pressure, which could lead to dizziness or fainting. This risk is higher when you first start taking the drug, if your dose is increased, or if you restart treatment after stopping. During these times, it's important to avoid situations where you may be injured if you faint. Keep in mind that it may take up to 4 weeks before your symptoms improve. If you haven't taken the drug for several days, contact your doctor to see if you need to be restarted at a lower dose. And as always, tell your doctor if your condition does not improve or if it worsens. Some common side effects of Tamsulosin Hcl include dizziness, lightheadedness, drowsiness, runny or stuffy nose, and ejaculation problems. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, if you experience any serious side effects such as fainting, it's important to contact your doctor right away. In rare cases, males may experience a painful or prolonged erection lasting 4 or more hours. If this occurs, it's crucial to stop using the drug and seek immediate medical help to avoid potential permanent problems. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, especially of the face, tongue or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Tamsulosin Hcl, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to this medication. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, tell your doctor or pharmacist about your medical history, especially if you have low blood pressure or certain eye problems like cataracts or glaucoma. Tamsulosin Hcl may make you feel dizzy or drowsy, and using alcohol or marijuana, cannabis, can increase these effects. It's important not to drive, use machinery, or do anything that requires alertness until you can do it safely. It's also recommended to limit alcoholic beverages and talk to your doctor if you are using marijuana, cannabis. Before undergoing surgery, including cataract or glaucoma eye surgery, make sure to inform your doctor or dentist if you are taking or have ever taken this medication, as well as any other products you use, including prescription drugs, non-prescription drugs, and herbal products. For older adults, they may be more sensitive to the side effects of this drug, especially experiencing dizziness and low blood pressure when getting up from a sitting or lying position, which can increase the risk of falling. During pregnancy, Tamsulosin Hcl should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, it is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Tamsulosin Hcl, as they can change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some drugs that may interact with Tamsulosin Hcl include other alpha blocker drugs like prazosin and terazosin. If you are also taking a drug to treat erectile dysfunction or pulmonary hypertension, such as sildenafil or tadalafil, your blood pressure may get too low, leading to dizziness or fainting. Your doctor may need to adjust your medications to minimize this risk. Additionally, other medications can affect the removal of tamsulosin from your body, which may impact how tamsulosin works. Examples of these medications include adagrasib, azole antifungals like itraconazole and ketoconazole, clarithromycin, cobicistat, HIV protease inhibitors like lopinavir, mifepristone, ribociclib, ritonavir, and others. Always consult your doctor or pharmacist for more information. If you or someone you know has taken too much Tamsulosin Hcl and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the US, you can call the Poison Control Center at 1-800-222-1222, while in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include severe dizziness and fainting. It's crucial to get help as soon as possible in these situations. It's important not to share Tamsulosin Hcl with others. While taking this medication, you may need to undergo medical tests such as prostate exams and blood pressure checks. Be sure to keep all of your medical and lab appointments. Consult your doctor for more details on how this medication can benefit you. The recommended daily dosage and optimal timing for taking Tamsulosin Hcl will also be determined by your doctor. If you forget to take a dose of Tamsulosin Hcl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and continue with your regular dosing schedule. Do not take an extra dose to make up for the missed one. It is important to take Tamsulosin Hcl at the same time every day to maintain its effectiveness. Now let's talk about the proper storage and disposal of Tamsulosin Hcl. It's important to store this medication at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and out of reach of children and pets. When it comes to disposal, do not flush Tamsulosin Hcl down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to dispose of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.